Drancunuliasis. Drancunuliasis is also known as guinea worm disease. It comes from a helminth. The causative agent of drancunuliasis is guinea worms. You can get these by drinking unfiltered water or unsafe water. Also, animals can get this disease. It is a eukaryote and a nematode. They are multicellular parasitic worms. Drancunuliasis are a type of helminths. The Drancunuliasis male worm dies after mating, and the female matures for 14 months and emerges out of the skin in a blister or an ulcer. When you put the infection under fresh water, the female worm releases its hundreds of thousands of eggs into the water, and after 2 to 3 weeks, the water is infected again, and this completes the worm cycle. The stages of a nematode are the egg, the juvenile stage, and the adult stage. Nematode sheds and then increases sizes. The worm can get up to 30 inches long. What is the underlying cause of the disease? A parasitic infection. Most must drink water contaminated with copepods to get the disease. Copepods contain larvae of D. medinis. A parasite is an organism that feeds off another organism to survive. The worm larvae penetrate to the stomach and intestine, taking refuge in the abdomen. When the adult female worm gets pregnant and migrates to connective tissue, after a year passes, the female worm forms an ulcer and emerges from the skin. The history of the worm. Drancunuliasis was discovered in the 1970s. The first discovery was a guinea male worm in a mummy estimated 1000 BCE. This is an ancient disease. There was 3.5 million cases in 1986. It infected people all over Africa, and then it also spread to 20 other countries. It is an endemic. Has been around for as long as we know. The worm has dated back as a long time ago, and before we didn't know what it was, and people could get sick from it. And the people that got worried when they noticed a worm emerging from their skin, then we figured out what it was and found a treatment. There's rarely any death from this worm, but it should be treated. Untreated people could keep getting sick from it. Nowadays, nobody worries as much anymore because people rarely die and it is very treatable. Back then, we didn't know what it was. For treatment, you can pull the worm out slowly every day. It takes a couple weeks to treat. There is no drug to take or vaccine. It takes 10 to 14 months to get the worm fully out of your system. The epidemiology. The disease is most common in 13 countries in sub-Saharan Africa. 4 of the countries are Angola, Chad, South Sudan, and Cameroon. The last reported cases were in 2020, and there were only 27 human cases reported worldwide last year. The rate is slowly decreasing as of now with the cases. Guinea worm disease is limited to villages that depend on contaminated sources of drinking water. The prevalence ranges from 15 to 70%. The morbidity rate is low and the mortality rate is high. They do not act as reservoirs of human infection. They are transmitted through the mouth and then into intestines, and then usually come out some part of the leg. Pathology. It affects the whole body, but mainly the intestines and organs in the digestive system. It inflicts redness and swelling of the skin and blisters and gets you feeling very ill. It does some immune damage, but it is not permanent. The time sequence of the disease is 10 to 14 months. You start to feel the symptoms after a year of the infection. Reactions to the infection are fever, itchy rash, nausea, vomiting, diarrhea, dizziness, hives, and burning pain. Response and treatment to the disease. Our body gets ill from the worm, but it can't do much to battle it off. There is no medical treatment, but you can go to a doctor to have them help you pull it out. If you do not get treated properly, you can end up with abscesses, sepsis, tetanus, gangrene, lockjaw, arthritis, or contractures. Guinea worm is a thin white worm emerging from a blister. If too much pressure is applied on the blister, the worm can die and make it extremely painful for the infected person. Make sure it is well cared for. Gently massage the area around the blister. It can help loosen the worm. Ibuprofen helps the pain from this disease. Socio-politico-economic. The Interagency Steering Committee for Cooperative Action for the International Drinking Water Supply and Sanitation Decade proposed the elimination of drancunuliasis, led WHO, and the United States Center for Disease Control and Prevention to formulate a strategy for the eradication. They need to have all the water filtered through a tank so people can have safe drinking water and we can eliminate the guinea worm disease. Disease affects economic and social burden for affected communities. The GWEP targeted unsafe drinking water sources with guinea worm larvae with the approved chemical tempefos to kill the copepods. And these are my resources. And thank you for watching.